yes, I have to say I'm really ashamed because I mean it should be our job to help you. But I have to say that there is a problem from psychiatry to find people. I was fighting for roughly 4 years to find someone, a senior physician, who would build up a service like that. And it was interesting to see why that is not happening. And I think maybe we should liaise on that and, you know, do more promotion, because a lot of people don't know that, what I was listening to. I mean, to be honest, I mean, I knew some of that, but not all of that, what you referred to. Because I think for young people it would be very interesting, because they are educated well, so they should recognize, you know, your complaints and, you know, and could be able actually to differentiate what is now real illness or what is, you know, complaints, but should be taken seriously because they were educated that way. That is just a remark. Mm-hmm. But I have a question. I mean, what we speak about is stigma, right? I mean, but, you know, we're living with that quite comfortably. But my question is, what do you think could be done from your perspective? I have a philosophy on that, but what could be done in order to overcome, you know, this idea that, you know, mental illness does not exist, and if it exists, it has something to do with discipline, full stop. So, any ideas?
Anyone?
Yeah, I mean, this is really the most difficult question now, and I really agree so much, 100%, because this is so much about communication and stigma, and it's also really, we have to admit, being a healthcare professional, it's not so easy also for the healthcare professionals to break the stigma and to ask and to talk about the mental health issues, because then, as a healthcare professional, it might be that you feel helpless, and then you avoid it, it's really, it's not the normal thing to talk about it. Mm-hmm. And so, what we, for example, also maybe this can be a little solution. What we did in our team, we really have in our follow-up clinic all the disciplines in the room. So there is the social worker, psychologist, and of course physician for the late effects. And then maybe at the first follow-up care visit, the family thinks, oh, what happens? Why is the psychologist sitting here? Yeah, because also the family has the stigma, and as you mentioned, it's not so easy to talk about it, to tell about your mental health issues. But then we tell them, okay, the late effects are biopsychosocial. Mm-hmm. This is because of the treatment and the disease and so on. So it's the normal thing to have the team biopsychosocial. And then this is really a relief for the families, because then they think, okay, it's okay to tell them because they want to listen, they're here for it. And this really, in this small bubble, kind of breaks the stigma, because it's not anymore a shock that the psychologist is here and that people think, oh, she's here, and then I will hear about maybe a relapse. Yeah, it's the normal thing, and people prepare. And we tell them, please tell us everything, because we need to know, otherwise we cannot support. Mm-hmm. But I know at the same time this is only a small step.